Lovely, thank you. It's always good to do something different in Parliament Week, something outside Parliament, and I really thank Rachel for inviting me today. Rachel left us last year, and I said to Rachel, you have to come back to the Ministry of Health. So thank you, Rachel, for intending to come back to the Ministry of Health. We'll have you back. So anyone in the room who's Rachel's boss, Rachel is coming back to join us. Thank you. I was sitting there with Dr. Donald Wilson, the Associate Dean of Research at the FNU, and also Dr. Paulo Bibili, the Director of Public Health Division at the Secretariat of the Pacific Community. Paula, Don, and Donald go back a long time. We were in school together. I was a year ahead of them. Chronologically, I was a year ahead of Donald, but I was younger than Paula. And Paula kept on reminding me all throughout the years. And I always wondered why he kept on reminding me that he was older than me. Because obviously, being older by 1 year throughout the 6 years, you want to tell the younger people what to do. But now seeing his gray hair, I'm really thankful that he's older than me. Thank you, Paula, for being here and being able to come and also see what's happening in the domain of WISH. I would like to again welcome on behalf of government all the representatives that are here from all around the world and the Pacific. From the University of Sydney are here, Edith Cowan University, obviously the FNU, Wildlife Conservation Society, the Minister of Itoke, the Director for Conservation at the Ministry of Forests, and the RISE project coordinators, or revitalization in informal settlements, the WISH staff, everybody guests, ladies and gentlemen. I want to start by saying that last year alone, I think I saw about 300 villages and easily about 100 informal settlements. We went and visited them. I have a rule. I spend morning till 12:30 in the office. In the afternoon, I go. And it's not all bad. There's a lot of villages out there who are doing it really right. And my target is WASH. That's all I want to do, WASH. WASH apart from NCD and all the other things. If you can just get WASH right and eliminate LTDs, then we can concentrate on NCD. That's my theory, very simple. Because what was happening in the hospital services that I seem to see was that we were struggling dealing with the complications of LTDs. So people coming in with ruptured typhoid, gastroenteritis, and having to do laparotomies to try and put them back together again. Those who are bleeding insensibly from hemorrhagic dengue. Those who, obviously had leptospirosis and had all the complications of leptospirosis. And then on top of that, you had NCD and all its complications. So I had a very simple theory, simple philosophy, that is, we need to eliminate LTD and TB. Just eliminate, get it out of the way. Just don't think about it anymore. And then we can deal with NCD, focused on NCD. And that's what we've been doing over the last year. Within the areas in which have been talked about, the areas in which there was a lot of typhoid, dengue, around about this time last year, and in the first 3 to 6 months of last year, we had 750 leptospirosis, we had nearly 3,000 dengue cases, we had about 5 deaths from leptospirosis, and quite a significant amount of typhoid. As we speak now, from the end of last year till now, we've only had 24 dengue cases, and they were all up in Lambasa. We've had only 3 leptospirosis cases and 8 typhoid, 6 typhoid. That's all we've had. And the reason is because whole of last year we really worked hard in the communities, in the villages. We just concentrated on WASH. We went to them, we visited them all over the nation, and we went to them and we talked about just making sure that we get their water right, get their sanitation right, and then we get the public health team to make sure that we do a cleanup campaign in the informal settlements from Lami to Nosori and Nandi all the way to Mba. We made sure that we put skip bins, so all their whiteware went into the skip bins, all the old tires went into the skip bins. That's what we concentrated on. And the numbers have reduced dramatically. And one thing that I've been doing this week while I was in Parliament is reminding our Public Health Division that they need to carry on with that. We can't just sit back on a laurel and say that, we've done well, the numbers are low this year, And that's why we've been able to, as a Minister of Health and as a government, concentrate on the measles campaign, concentrate on the coronavirus campaign, because our LTDs are actually low. Because we spent a lot of time last year really working around it. And I'm very grateful for the opportunity to be here, to be able to share with you, but also to thank WISH for this project, because it's another arm, another arrow in the quiver in the fight that we have against communicable diseases. As I said, I'm honored to be here, and the WISH project is the first project in our country to embrace an integrated preventative approach to tackle the 3 plagues. And when I came in to the Minister of Health, I said, my wish is within the next 3 to 5 years, we eliminate. We eliminate, meaning we try and eliminate lepto, typhoid, dengue, and hopefully tuberculosis. And we need to do this, and as WISH is doing, through actions that will simultaneously bring benefits to the environment and to people. Globally, as we all know, waterborne diseases kills more children than AIDS, malaria, and measles combined. I was reading an article, and in Singapore, the experts in Singapore were saying to the government, because they're having about 300 dengue cases a month, they're saying it is likely that they will have more dengue cases and more dengue deaths than they will from coronavirus. So, yes, there is coronavirus. Coronavirus is in there, but we can't lose focus of what's happening on the ground. So we need to be able to make sure that we sort out the normal communicable diseases that plague our nation and the Pacific Islands on a regular basis. If not, what's going to happen is we're all going to be looking north when we're going to be attacked from the south. And that's my thoughts around that area. And also, as we know, in the Marshall Islands, there's been almost more than 3,000 dengue cases that's been around in the Marshall Islands. New Caledonia, which is, a place that is more French than the Pacific, has had more than 80 dengue cases. Okay, a place where Dr. Paula, the Secretariat of the Pacific Community is. So they've had 80 dengue cases. So you can see these are real. There's more dengue cases in New Caledonia than there is coronavirus, because they don't have any. Okay, so do you understand where I'm coming from in regards to we need to support this? Outbreaks have been very common in Fiji up until recently. I say recent because I know that we've been doing a lot of work recently, and our numbers this year are testament to all that good work that's been done by our public health people. And these outbreaks are amplified by environmental factors such as climate change. We can't change climate change, okay? And we need to be able to deal with climate-sensitive disease, land use, and changing social conditions. We've had 20 reported typhoid outbreaks from 2005. The last one was the beginning of last year, up in the Mosi Highlands and also in Naitasiri. What we did is we went and we found out what's the cause. So up in Naitasiri, we found out that it was because the water that was coming through, it was two things. Number one, there were 70 households, 50 toilets. Toilets with adequate sanitation, water seal or flush. The other thing that we found out was that when the water came, there was no holding tank. So in the morning, when the kids all got ready to go to school, and it was one of those villages that was close to the main roads, obviously people were coming into Suva to work, which was about 1 hour drive. That in the morning, they all used the water, there was not enough water, and they were ending up going into the rail river or into the creek to be able to get water from there. So we did a simple project. We put 2 10,000-liter water tanks that held water in the night. We also made sure that we had water-sealed toilets for the other 20 households. And so far this year, there hasn't been any typhoid in that community. Also, the same thing we saw in the Mosi, and we did something very similar in the Mosi. And Charlotte was just speaking before I spoke, when I came into the room. She was heavily involved up in Waqainabete area in towards the later half of last year, third quarter of last year, in the wash projects that we did there. And Charlotte alone, on her own, she went and slept with the villagers, taught them about wash, and through herself, she put in 250 water-sealed toilets. That's Charlotte, the one that was talking there. So she's talking because she's done it. The WISH Fiji partnership is working with national and local government, rural communities and the commercial sector to take a systems approach to health and well-being through focused action in 5 river suburban catchments located in Telewu, Namosi, Waqainabete and Boer provinces, all of which had documented cases of typhoid, leptospirosis. The project has received endorsement from the key ministries, the Fiji Center for Disease Control, the National Drinking Water Quality Committee, the WHO and UNICEF. I like the Fiji Center for Disease Control. Those guys are heroes. Those guys are the guys who are at the back of what we do around measles and also the coronavirus. So it's just good to see that they've been mentioned today. As you would heard today, the WISH Fiji project is tackling drivers of disease and environmental degradation at multiple scales. At the watershed scale, they have identified risk factors driven by developmental activities which affect the ability of forests, streams and wetlands to provide natural flood control and water purification functions. At the community scale, they have identified issues with water and sanitation infrastructure and management of livestock, agriculture and pests that can contribute to disease. And through interviews with members of 311 households, the team has identified different behaviors that are immediate risk factors for all 3 diseases. Today marks the commencement of the next phase of the project, and I really look forward to actually watching this with interest and how this will have an impact, because I know it will have an impact, because I know what we did last year had an impact, and I know you will have an impact. And being able to see the specific interventions will be identified and implemented in each of the village projects, and making sure that it's not a cut and paste, because really what it is, every settlement is unique, and we need to be able to make sure that it is actually targeted to the need in every village. It was interesting, we went to one village in Waqainabete and we fronted up to the village, we did a service, and then I said, let's get the profile. Everybody washed, everybody had a flush toilet, everybody had adequate water, everybody had a backup water tank. There was no LTD in the village. So I said, okay, thank you very much. Let's talk about non-communicable disease. Yes, and that's my wish. My wish is that, that will be all around Fiji. Whatever you do and however you do it, my vision for the nation in respect of the 3 diseases remains, and I've said it before, I want us to eliminate it and eradicate it. And thank you for the invitation to be here, because it's just something I'm really passionate about at the moment, and something that we've been doing with so much guts over last year. And seeing the results that we've seen so far, and knowing that you're going to have awesome results, I just want to thank you, wish you all the best.